Hello class. Today I'd like to go over the second of week three's assignments, the operational policies for HIE. Now I know a number of you have sent me some emails about being a little confused about this project or about this assignment. So I wanted to just give you some guidance as to how you should approach this. Now here I've opened the assignment, and what you can see in front of you is the action items. And again, as I did with the various models of HIE, we'll go over some of the things that I'm looking for, but I'm not going to get into how to write the paper because we've already covered that in the various models of HIE presentation. Instead, I'm going to go over the specifics of this. Okay, so the first step it says here is to read chapters 18 and 19 in your textbook and additional course materials that are in week 4 and to get the week 4 get started. Now the second item here is a little confusing for people. So what I wanted to do was just click on it and talk to you about what the MDS is. MDS stands for minimum data set for nursing home. And in this case, the MDS is for the nursing home resident assessment and care screening. And it gives you a sentence here, but I'll give you some more detail. And what it says to us is that this document identifies all of the information that needs to be shared between a nursing facility and various regulatory agencies. What the minimum data set is just that. It's the important required aspects of care that we would need to send to the HIE in order to facilitate care. Now remember, we've learned that the Health Information Exchange is a clinical database. It houses all of the clinical data necessary in order to properly treat the patient. So we're really not going to be too concerned with things that are outside this minimum subset. Also, if you were going to go to your local hospital and you were going to ask them to release your health record, they would release something um, similar to this. It's the minimum data set. It's the minimum sort of summary of data that is routinely used in order to properly care for a patient. So that's why it's here. Now let's click on it and I'll show you what it is. So here it is. It's downloading. So let me just open it up here. And hopefully you'll be able to see it. Okay, so this is the minimum data set for nursing home. So let me make this just a little bit bigger so that we can see what we're talking about here. Now this has some demographic information in terms of date of entry. And the date of entry here would be similar to like an admissions date. But you're not really admitted into a nursing home. You enter a nursing home. Okay, we don't admit people similar like what we would with an acute care hospital or another type of treatment. Instead, it's called date of entry. So this is the date that the stay began. Okay, and it does not include readmission if the record was already entered. This is the date of the first entry, the first time you presented to the nursing home. So you'd have 2 digits for the month, 2 digits for the day, and 4 digits for the year. This next one goes over admitted from, okay, and this would say a private home, apartment, no home health, private home or apartment with, this might even be from another nursing home, an acute care hospital, psychiatric hospital, rehab, or other. Okay, and this just contains some data about the patient coming into the nursing home. So as you can see, as you scroll through here, these are all the requirements that nursing homes are required to send to the HIE in order to facilitate care. So as you can see, the types of data that are here. Okay, and it's a very small subset. We might have had just volumes and volumes and volumes of information, but for the purposes of the HIE exchange, we're only going to send this data. So that's why the HIE really looks for just a minimum subset of the care you actually provided. So that's why this document is here. And it's a little confusing because this is the first time that you've really heard anything about it, so you're not really sure what you're supposed to do with that. Now, what I want you to do is to look at the research that you conducted in week 1. This was, remember we talked about the centralized, decentralized, or hybrid models of HIE. Okay, so based on whatever HIE models that you identified in the first assignment and that various models, you're going to use here. So, for example, if in your various models of HIE you defined your state's HIE as being centralized, then that's what you're going to need to use when you're making the comparisons and you're doing the work. Okay? If you identified your state HIE as being a decentralized, then that's what you're going to use here. If you are a hybrid, then that's what you're going to use here. So based on whatever you identified in the various models of HIE is what you're going to use here. So then step 4 is based on your readings and the MDS document shared above. It wants you to write a paper that includes at least one flowchart, and we'll take a look at that in a minute in part B. So in 2 to 3 page, write a policy for managing how the MDS information should be exchanged with your state or regional HIE. So that means that if you are dealing with a centralized HIE, then you need to go back and figure out how information is exchanged in a centralized model. If you're decentralized, you need to go back and read how facilities exchange information. Okay, that's what they're really looking for here. Okay, so if you're unable to find your local, then you can focus your policy on the exchange of information with Medicare. So what this policy is supposed to talk about is how are you going to deliver that information to the HIE. Okay, so for instance, I want you to talk about a policy. What are all the components? Now, in New York State, and what we've experienced with our healthcare is that they will present us with a consent form, and that consent form will provide us some guidance on um, what is sent and why it's sent there, and it gives me the option of do I want it sent or not sent. It will also tell me the components of the information. Now, I'm not looking for you in this paper to give me every single item that's in that first MDS document. What I am looking for you to do, though, is to identify, we will send a limited subset, and we will use the following information. And you could say we're going to create a minimum subset document that we will share with our patients as a representation of what we're going to send to the HIE. Then you're going to talk about we're going to provide this at the first visit. We're going to give our patients the opportunity to complete a consent form. Now, one of the things I also want you to think about is patients are not mandated to do this, meaning they have a choice. They can say, yes, I want it, or no, I don't. And if they choose not to do it, then you also need to have some sort of an idea as to what you're going to do if the patient decides that they don't want it sent there. Okay, so I would like you to look at, just write a paragraph or two of what you're going to do if the patient decides they're not going to consent to this. Okay, so that's the policy and procedures that we're looking for here. So what it's telling you is it wants you to think about, pretend that you're the person who's tasked to create this policy. How are you going to do it? You have, at a minimum, you have to send all of that information that's on that first document, on that minimum data set, to the HIE. So that is what you are tasked to send. Now, How are you going to go about doing that? Well, there's a couple components here. You want the patient piece and then you want the operational piece. Okay? So think through that. And what I recommend is just write some steps down to begin with. Okay? Things like, well, first of all, I'm going to have to make sure that I have all this information in one piece. So I might adopt a form that has all of the components of the MDS. That way then I have an easily transferable information to the HIE. And then because my state, and I'm just using this as an example, is a decentralized format, I now need to send it to an intermediary who will format the data and then send it off. Okay, so that's what I'm looking for. Then after I've created that form, I'm going to implement a policy that says the patients are going to be given a brochure. They're going to be given a consent form, and we're going to share with them the components of information that we send to the HIE. And then we're going to give them the ability to ask questions. Once their questions have been answered, they're going to complete the consent form, hand the consent form back to the office manager. The office manager's then going to do this, and this with it, and then it gets transmitted. Okay, that's what we're looking for here. I'm looking for you to think about writing a policy on how you're going to transmit those components in that document, in the MDS document, to the HIE based on the model of HIE that you have. Okay, so there's lots of resources here to help you do this. All right, so the first, she says here, for an example of a policy, review section 2. So this was the first document that we saw from our various models. Whoops, I have two of them here, so I'll just open this up. Okay, so this is loading. Okay, so it's, there it goes. Okay, so let me close this up. So here are so she said section 2. So here's policies for clinical data exchange. So you're going to want to use this as your guide, okay? As to what you should include. Participants, termination and suspension of participation, release and disclosure of patient information. So these are all things in this section that you should take a look at and make sure that your policy includes. So maybe what you want to do is look at section 2 here, okay, and have a few. If this were me, this is how I would approach this assignment. I would put at the top of my paper policy for clinical data exchange, and then I would put here for the 2.1, you do not have to put the numbers, okay? I want this formatted in APA format. So this right here, federal, state, and local laws, would be your first heading after your introduction, okay? And we spoke about what's a good introduction, but your first heading would be state model of HIE. So whatever you picked in your various health models, you're going to put here, okay? And you're going to provide a paragraph. We shall comply. It's a centralized model, so this is how we will exchange it. Okay, the participants will comply with all federal and state local laws, including HIPAA, as far as their exchange as it pertains. Then you're going to talk about data sharing. So you may talk about, we're going to exchange the components of the MDS with the health information exchange. And some of those components include blah, blah, blah. And then you could say, see attached for complete listing. But you're going to want to include them here. Okay? And it tells you that they have the right to audit your process at any time. Now the participant is the participating facility. So that would be you guys. Now you don't have to worry so much about that, as much as you want to just have a couple sentences that talk about um, that you're a nursing home, that you um, receive patients from outside facilities, some of those components that we talked about at the beginning of the MDS. And then termination and suspension, you're going to want to make sure you include that. What I'm really looking for here is the release disclosure of patient information. Okay. And you're going to do that based on whatever model. So, you know, if you have sensitive information, things like HIV or AIDS or drug and alcohol types of things, then you need to make sure that you have provisions for that. Okay, and in your chapters for your reading kind of goes over some of that as well, so that'll help you here. And then it'll be patient notification of disclosure. How are you going to notify your patient that you disclose information? That's where I said your policy may say, okay, I'm going to notify my patient when they come in the door. I'm going to give them a brochure. I'm going to give them a consent form. I'm going to mark on that consent form if they have any questions, yes or no, and ask that they check the box. So that way I can ensure that their questions were answered. Now you're not going to actually use the verbiage from here, but you're going to use the titles as part of what you're going to look for. What kind of access are you going to have um, to the data exchange? Okay, obviously it says they'll provide access based upon request. Well, you can't put that there. You have to talk about how you're going to do it. Are you going to do it after every transaction? Are you going to do it at the end of the day? Now you may be sitting here saying, well, this is all well and good, but how do I know? And that's going to be something that you're going to know when you should do it based on whatever research you've done. So if you say, what's a best practice for submitting data? Well, since we're a nursing home, we might not have the capabilities of being able to send it right as it occurs. So we're going to send it once a day or once a week or whatever. But that's where you're going to need to do some research to sort of find out what's required. But these are the types of sort of headings that you should think about as you're creating your policy. That's why they've recommended that you use this as your guide. Now this isn't the all-inclusive, but this is definitely the areas you're going to want to look at. So I would come over here in this document and I'd go up to and I'd open this navigation, because that navigation is going to give you all of your titles here. Okay, and how do you open the navigation? You come to view and then you click on navigation pane. And what that'll do is it'll give you all of these headings. So when you're writing your paper, all you have to do then is say policy for clinical data exchange, state laws, federal laws, data sharing agreements, termination, release of information, patient notification, and then breach of disclosure, access, authentication, auditing, and um, that's really the ones that we're concerned with. Okay, how do you maintain a secure environment? How do you ensure that you're going to do an audit to locate the proper information? The headings that you have here in section 2 are some of the things that you're going to want to talk about. Now granted, you're going to have a 2 to 3 page paper, so my advice to you is to make sure that you touch on these things and don't just say I'm going to have a data access policy. Okay, what is that going to look like? I'm going to have a data access policy that's going to say that each person only has access based on their role in the facility, or each person is going to have access only to the minimum data set. Okay, you can't just tell me you're gonna have a policy. I want a sentence or two of what that policy is going to look like. Okay, so that's when we're talking about that, that's what we're looking at. So let me come back here. You're also going to want to look at this privacy and security policies for health information exchange, because this is going to give you examples of what you're looking for. So here's a draft policy. Okay. So the use and disclosures of information, right here are the things that you're going to want to pay close attention to with this as well. Okay. So this will go through, it'll give you all those definitions. We looked at this um, in the last session in the videos, but right here, shall at all times comply with applicable HIE policies. So when you have participant policies, that's you as the organization. So you're going to want to include things like, when do I notify somebody? Consent forms. What am I going to do if they don't consent? How am I going to secure the data? How am I going to do an audit of the data? So if you get those 5 or 6 main things and you're able to provide some guidance behind that, I think you will be in very good shape for this assignment. Okay, so let me come back here. Now, the second part of this assignment is asking you to create a flow chart. Okay, and that flow chart, what did I just do? Must be I deleted it out of here. Okay, so let me log in here then. If you'll give me just one more second, I'll log back in and we can take a look at this. Okay. So let me come down here and look at this one. Okay, so our operational policies. Okay, so now that we're back, the second part, or part B, is based on what you wrote in your policy, create a flow chart that provides a visual explanation. Now, what I'm looking for here is a policy for you to explain to me how this is going to work. Patient is going to receive, we're going to complete the MDS. The MDS then is going to be compiled, it's going to be reviewed, and then we're going to notify the patient, if this is your policy, that they have the right to consent to having their information sent. And then you should have a path that says, did patient consent? Yes. Okay. Then information is then gathered and sent to the HIE via this type of a transmission. And when I say this type of a transmission, is going to be governed by whether you're central or decentralized, because there might be like a third party that has to come in there based on the model of your HIE. But for our purposes here, let's talk about this. So we've gathered it all up. We're ready to send it. We send it once a day to the HIE for processing. If the patient does not consent, then the record stays right there and there's no transmission to the HIE. Okay, that's what I'm looking for here. Take that policy, take those 5 or 6 different headings that you put in the body of your paper and create that flow chart. So if I were doing this, one of the things I think I would want to do is say, patient presents to nursing home. Information is gathered for that admission. Patient is provided with consent form for release to the HIE. Patient is provided with education on what is the HIE, how it's used for. Then you have a box that says, does the patient sign it? Yes or no? And again, then you can go from there. But you also want to make sure that what you've written in your policy is depicted in the flow chart. So if you have a particular path that this is going to take, that's really what I'm looking for, is the path that it's got, that MDS data is going to take from your nursing home facility to the HIE. Okay, so that's really what I'm looking for when I say a flow chart. Okay, and the documents that are here for creating a flow chart in 2013 and how to create one is right here. So once you've gotten all of that information taken care of, you are going to write your paper. It's got to be an APA format. Do not forget your in-text citation. Do not forget a reference page, okay? Make sure that you're under like 23% and turn it in, and then submit your paper to turn it in. Remember, no turn it in, no grade. So make sure that you give yourself plenty of time with the turn it in. You can't wait to the last minute and think you're going to get your results back from turn it in quickly. Okay, so this concludes this session. If you run into additional questions after listening to this video and taking a look at the documents you have, then feel free to send me an email. Okay, have a great day, and I look forward to reading your papers.